Hello, wanted to come back on here and make another video. Basically because I see how many views that my videos about going back to school as an older adult has gotten. But this video is slightly different because I know there is some anxiety from people that go in or are thinking about taking that step to go back to nursing school. Whether you are an older adult, and by older adult I mean you didn't go straight from high school to nursing. So this is my definition of it. I went to nursing when I was 35. So to me, I'm considered an older adult. That was not my first career. Or I don't even know if I had a career in the first place. Like I took a job with the state and that was the move. But if you have anxiety about what nursing could entail and you don't really want to be at the hospital or doing face-to-face interactions with patients, this is an alternative for you. They always drill into us in nursing school that there's only bedside. I mean, you don't ever hear about anything else because they are training you for life-saving skills that will be needed in the hospital. But there are other things you could be doing. So as an older adult, depending on how old you are, your life may be different. You might have a family that you need to be there for. You might need all your energy for that family. You may also have some ailments and wonder if bedside nursing or nursing period is right for you. But I'm here to tell you that there's another way. So I'm going to be looking down at my phone because I'm going to tell you pros and cons and all the information and ins and outs you need to know. So the other alternative is becoming a nurse or a case management nurse or anything that will allow you to work from home. I am currently a nurse, and people don't understand that nursing can be an umbrella. Basically, it can include PA nurses, which are prior authorization nurses. They're going to get you an authorization if the member or the patient needs an x-ray or physical therapy. They're going to approve that service. If you send them in some progress notes or chart notes that lets them know why the patient or the member needs these services. You could be an inpatient review nurse that reviews medical records each and every day and extends an authorization for more days for the patient that is currently staying in-house at an acute care facility. You can be a concurrent review nurse, somebody that is coming from acute care and needs to transition to a skilled nursing facility or a long-term care facility, and they need that authorization before they admit, or they're currently in the facility and need continual authorization for another 90, a year, 6 months, things like that. So those are some of the titles within There may be more, I'm not sure, but from my experience, that's what it is. Some insurance companies also loop in appeal nurses as well. So let's say that authorization on the front end got denied because the provider didn't send in the needed medical documentation, or just basically they didn't meet the criteria that's already set in these guidelines called MCG, Milliman criteria guidelines, or clinical guidelines, or interqual, which we use those guidelines to look at the medical records, compare it to the criteria needed for a patient to get an authorization or to continue on in the acute care facility or transition to a rehab facility or ambulatory surgery. Those are the guidelines that we basically use, or in-house procedures. So if they failed to meet those criteria, an appeal nurse would come in on the back end, a provider would give them more information, and hopefully they make a different decision, like overturning the denial or continued denial, or partial approval. So I've worked for 2 insurance companies, and they are ran basically the same. I was an appeals nurse. I am now a nurse. So I got to see what it's like on the back end, and now I'm on the front end. So basically, for those of us joining nursing or thinking about taking that leap, here are some of the pros for why you would like a work from home job or to become a nurse or case management. You can make more money than travel nursing. And this is something that we're told in nursing school, that, oh, travel nurses make the most, or NPs make the most, or, you know, working in the ED makes the most, working in the ICU makes the most. These are all fairy tales, basically. You need to do what you need to do to make your money, basically. As a work from home nurse, I have the opportunity to take on more than one job because I work from home. Now, do these employers know about each other? No. Oftentimes when you're working two jobs, the employers don't know each other or don't know that you have two jobs. So that is something that you would have to do. Mum's the word, like, do not tell. I no longer work two jobs. So, so I do have some experience with that. The pro here is that you do make a lot of money depending on how many jobs you can take on. So you can take on, if you can take on 5 jobs, do that. The ideal thing here is that being a manager at one job would be ideal. Being a lead at one job would be ideal. Having a job that doesn't require much of you, like not strict deadlines. Those are things you want to look for. Jobs that don't require face-to-face meetings all the time. Those are good as well. Like, you don't have to be on camera on Teams. Those are good jobs that will help you to manage these multiple jobs. Now, another pro is that you can get double retirement to help yourself retire earlier. So that whole extra check, let's say if you only have 2 jobs, that whole extra check can go in your retirement. Like the whole, let's say you're making $6K on that other job, the whole $6K can go into your retirement. You will be able to retire really early if you keep that up. In addition to that, double the insurance. If you want more medical insurance, so you got ailments or whatever, you got a child that has an ailment, double the insurance is a very good way to manage those costs. Medical, dental, you got it covered. Of course, you get double payment, double checks. Less body breakdown. So you're not at the bedside, and we all know the ailments that come with those nurses that have been there for like 30 years. Back-breaking labor is what inpatient bedside nursing can make you end up with. You could have back problems. You can have all kinds of problems with your mobility as you're helping patients, which God bless bedside nurses because we deal with a lot. But body breakdown, your circadian rhythms thrown off if you're a night nurse, bags under your eyes, aging fast, like unable to lose the weight because you're so tired all the time, like you're just exhausted. You don't deal with that. When you work from home, I myself, they always tell you get up and move around, of course, because there is always that thing where you could be not moving as much as you should as you work from home. But what I've done is I have a gym in my garage. So I make sure I'm on that treadmill at least 30 minutes a day. I'm lifting weights at least 30 minutes a day. Something to at least maintain my weight. So it's a pro or a con. Either you find the time to work out or you don't, and you could gain weight working from home. So hopefully you do what's necessary to maintain your weight at least. And lose the weight if you need it. You don't deal with attitudes. That's another one. So there's no cranky MDs. There's no toxic nurses. At least in my experience so far, you definitely could experience that. But I think that it's less as you work from home because people are less stressed out. There is stress because you have deadlines to meet. But there is less stress, I have to say. Everybody's more willing to help each other. MDs are more willing to cooperate with you, give you a call, ask what you saw in the notes that maybe the reason why you recommended this type of decision to them. Things like that. Everybody's more cordial and happier, at least in my experience. And of course, no patients screaming your name or, hey nurse, or cussing you out, throwing things. None of that workplace violence crap. Less stress. To speak to that workplace violence thing that I just said, less stress. There's no anxiety, for me at least. And I'm an anxious person, or I can be. I remember when I was getting ready for my shift, sitting outside in the car, if I got a call right before my shift that I was floated down to the ED, and me being a new nurse, having known nothing about ED, and being changed to another environment with nurses that I don't even know, put me in such a bad mindset, that I ended up on the brink of tears. Like, I felt like, oh my God, my night's going to be horrible. There was always that anxiety anyway before I started a shift, because you have no idea what kind of patient load you're going to get. And this is just me, not saying this will happen to you. But I had anxiety a lot of those times. But then once I got on and got my flow going, of course, that anxiety dissipated most of the time anyway. And other times it was as horrible as I thought it would be. Another pro is you have more time for hobbies. I learned that I can draw and I can paint. As you can see here, I have a lot of paintings on the wall. Before, when I had 2 jobs working from home, I had time for nothing. I didn't work out as much. I had no idea what my hobbies were. It was a bad situation. And once I quit that job, I focused more on my family. I started to figure out what my hobbies were. I thought it was reading. I do love to read, but give me a book at the wrong time, I'm going to fall asleep. But painting, it's calming. Drawing, and then knowing that people can figure out who I drew, or the likeness of who I drew, because I'm not a portrait artist. Like, I'm not going to draw you to the T here. Hopefully someday. It is gratifying and satisfying to me when somebody can figure out who I drew. But I've done things that I didn't know I could do. Like, I drew this. I didn't know that I could do that. It's amazing. And sometimes you just need to take a pause. With as crazy as bedside nursing can be, and as tiring as you can be, as tired as you can be after that, to clear your mind and to have the time to actually figure out what you're good at, or even do something on the side as you work from home to generate more passive income, is the best. I have been in real estate. We bought 2 houses in another state. I did all of that while I was working from home. It's the ideal environment for you to generate other passive income, because let me tell you, relying on nursing and just that, or relying on any job period alone, is not, to me, is not a good choice, a good use of your time. My goal is to get out of the rat race. I don't envy anybody that still needs a job. Let me make that clear. I want to own my time. Even if you are off a few months, basically travel nursing. I don't even envy travel nurses, because you still need to return to a job. You still need to go back. I don't care if you get some time off. The fact that you have to go back sucks. So I'm working on a plan to own my own time while I'm working from home. And luckily, the job that I have now is the best freaking job. My manager, my duties, I can't even sing enough praises. And the retirement system is great as well. Now let's talk about the cons. Some will say that you will lose your skills, and that may be true. You might forget how to do an IV. You might forget how to do an NG tube. You might forget how to insert a Foley. I don't think I have forgotten how to do those things. It might take me a little bit of time if I was back in the facility, I'm a new nurse again. But I'll do it. I'll discover how to do it eventually. But you do not lose your knowledge. Why I say this is because you're constantly reading medical records, and it's like a bird's eye view of the plan of care. So once you get used to, this person needs this procedure, you're going to see a pattern. And you're going to know that plan of care, if this next member goes in for that same thing, you're going to know that plan of care needs to involve this stuff. It's basically like when you're in at bedside, you're going to know what the plan of care is going to entail because you're constantly reading a new book every day. To me, it's like reading a new book. New medical records come in, and it's very interesting what some of these patients come in for. It makes you laugh sometimes. But it's like reading a new book every time. So I don't believe I've lost any of my knowledge. And another thing that's helpful with, at least for the 2 health insurance companies that I've worked for, and it's probably the same for all of them, they offer teachings or education. It's for the company I work for now, it's every week. For the last company I was at, it's every month. But every week you meet with the MD, like all of us as a group, and they will go over a disease process that you may be familiar with already, but who cares? She's going over it, giving her take on some of the cases that she had in the past in the inpatient facility. Or, you can also bring up some disease processes that you are interested in, you want to know more about, and she'll do a presentation on that. Everything's chill, but it's educational, and it helps to keep it top of mind so that you don't lose your knowledge. But another con is that other nurses or other friends or even family members will look at you like, you're not a real nurse. And to me, I don't give a shit about that. So that's what you have to be strong in. Don't give a shit about that, basically. Because people are going to say what the hell they want to say to make you feel less than them. You got licensed for it. When you do get licensed for it, you went to school for it. You got that diploma for it. So yes, you are a real nurse. If you can stand that, if you are tough in your mental to withstand that, then this would be a great choice for you. But overall, working from home is my choice. This might be a good alternative for those of you that are worried about having daily interaction with patients or working in a bedside, or those of you that want to escape bedside. I really do advise you to go get an insurance company job, maybe in claims, maybe in customer service, part-time if you can, just to get some experience, to get your foot in the door. Because when I was a lead for the other insurance company and it came time to interview people, there were a lot of applications. There were nurses trying to escape bedside. And although they are needed there, a lot of them have put in their time. They're tired of being tired. They're tired of treatment. If you have a great team and you're working bedside, that's great. Those are rare. Hold on to that if you can. But this is basically an alternative. And again, you have the ability to make a lot of money depending on how many jobs you have. I was at one time making $15K a month, and that's net. But it just depends on what you are willing to give up. So if you're sacrificing bedside, you may come to work from home and be really tired and stressed out because you have 2 jobs mentally. So it depends on the trade-off. Right now I'm good. We're good. Like, I'm at the top, just on cloud 9 because I have hobbies. I'm getting to work out more, spend time with my family. I love what I do, and I love my one job. But anyway, alternatives for you to think about, and I hope you choose wisely and choose the best decision for you. Okay? I'll make more videos hopefully soon. I don't know. This channel has been dwindling because life's been lifing. But anyway, have a good one.